Mr. Campbell, again, I appreciate you being open and honest with me, but I can definitely tell you at this point, based on the information that we have so far, you definitely meet criteria for what's called an opioid use disorder. Okay? And
So what does that mean?
yeah, I know it's hard to hear disorder, that word, but it basically means that you've lost control. And you definitely don't want to be doing the things that you're doing. And as a result of the opioid use, you're not functioning at a place where you need to.
Well, how am I supposed to manage my back pain without having some pain medication?
Yeah. No, I hear you. And again, I'm here to help. So I'm on your side. And I can only imagine how frustrating it is. One of the things that we can do is talk about some medications that not only will work for your back pain, but also for you losing control as a result of this opioid use disorder, okay?
Some other pain medications?
It's, again, these medications can be used for pain, but they're also used for when people are losing control as a result of their opioid use. So for you, it would be really good because it can treat your chronic pain and also the loss of control that you've been having with getting the opioids, okay? At this point, though, it's important for me to really understand kind of what your risks are in terms of your opioid use. So have you ever heard of a medication called naloxone, or the more common name might be Narcan?
Oh, I've heard of Narcan.
Okay, all right. Do you have access to that medication?
I don't have it, no.
Okay, so we definitely want to make sure that you have access to a Narcan kit, okay? It has the medication called naloxone, so that if you accidentally use too much of the opioids, we can make sure that that's available. You can't use it on yourself, but we want to make sure we give that education just so you know how you can teach others around you, okay?
Yeah, okay.
Yeah. There's many different forms that it can come in. The one that we have here, and it's easiest to use, is the intranasal kit, so we'll make sure that you get that, and also we'll make sure that you work with one of our health technicians so we can go through the education of how to use that.
So I got to carry this thing around with me all the time?
It'll be important for you to have because we don't want you to die accidentally from overdose. But what we'll also focus on is, like you said, you getting treated for the pain and also for the you losing control with the opioid use, so that we're not putting you at risk for accidental overdose death from opioids. Other things that I'd like to know in terms of where you're getting the non-prescribed oxycodone from. Are you buying it from the same person each time? Or?
I pretty much always get it from the same guy, yeah.
Okay. So that's another thing, just to make sure you know kind of what you're getting and you're not switching where you're buying it from. Yeah, okay. We mentioned the way that you're using, so the pattern of use. How much of the oxycodone are you using now? I know you started out, you said around 60 to 80, but where are you at now in terms of the use?
120 milligrams.
120 milligrams. And has it always been that, or did you kind of go up over time?
Well, the highest it ever was 160.
Okay. And then you cut back on your own? Or?
Yeah.
Okay.
Really, since that, work episode in New York,
right.
That's, kind of when I decided to stop the heroin, and I figured it would be easier to taper myself down if I was on, something like a pill, like the oxy.
Yeah, gotcha. Okay. Mr. Campbell, when did you first start using opioids? Ever in your life? Not even when it first became the problem, but just when did you first start using?
Ever?
Yeah.
I mean, in college, recreationally. Once in a while. Not.
When did you start off using in college? Do you remember?
Yeah, it was oxycodone, Vicodin, Xanax.
Gotcha.
Just kind of experimentally.
When did you notice it became a problem for you? In terms
Problem?
In terms of feeling like you needed to use it more or have to go and buy it. Was that?
Well, that was when my back got blown out, and I couldn't get it prescribed by the doctor anymore.
Okay.
I mean, I have serious back pain, and I know I need it for that, and I probably always will.
Okay. All right. And in terms of treatment, so have you ever been treated for the opioid use?
Mm.
Okay. Never went to any AA or NA meetings or anything like that?
I mean, I just got to say again, I'm not an addict. I'm just trying to manage the situation with my back. I mean, it's chronic.
Yeah, and I hear you, Mr. Campbell. I don't see you as an addict at all. I actually think that's a very stigmatizing word. It's just important for me to understand kind of what the full picture is so I know the best way to help you.
I know I said I did it recreationally in college, but I don't do this for recreation. I'm not trying to get high. I'm just trying to function.
Yeah, I gotcha. And we already went over the effects of your substance use, the problems with lying to your wife, the problems at work, things like that, concentrating, sleeping. Anything else that I'm missing in terms of what you're seeing in terms of using the opioids? Kind of any physical or emotional effects of that?
Well, I don't like the way I treat my wife sometimes. I guess I'm kind of, mean. I talk mean to her, and I feel bad about that afterwards. And she's pretty patient and understanding, but I really don't like that.
Okay. And in terms of periods of abstinence, you mentioned when you were in New York and you didn't have the heroin for a couple of days. Have there been other times where you were able to go for any particular period of time without the opioids?
No, that was pretty much the only time.
Okay.
That was pretty much the only time that I was, without.
And in terms of relapse, I mean, you went for those 2 days and then you went right back to the non-prescribed oxycodone use. Is that accurate?
After that business trip to New York, yes.
Yeah. Okay. All right. So that helps me understand the opioid use. In terms of any other types of substances, first time using, like alcohol or tobacco, anything else that you use?
First time in my life?
Mm-hmm.
Oh, I mean, high school, everybody smoked pot. I mean, that's, when I started smoking grass.
Is that a problem for you now, the pot, or do you use that now?
Yeah, I do use it. I mean, enjoy smoking a couple of times a week. It helps me sleep. And I don't feel so like that's a problem. I mean, my wife knows about that. She even smokes sometimes with me. Yeah, I mean, we drank in high school. We drank in college. I mean, drank plenty in college.
Do you feel like with the drinking, the alcohol use, that you ever drink so much where you like blacked out or something like that happen?
Oh, back in college, yeah. I know I had more than a couple of binges like that, but I mean that's decades ago. I drink beer now. Yeah, I don't know, a couple of beers during the week, maybe a few on the weekends when I'm watching a game or something.
But in terms of the substances that you're using now, between the cannabis or the pot and the alcohol and the opioids, which one do you think is really affecting your ability to function the most?
Well, I don't think the drinking some beer and pot is bothering, is affecting me at all.
Okay. All right. Anything else? Cigarettes, tobacco, anything else, anything like that?
No, never smoked cigarettes.
Okay, good. That's one of the best things you can do. No cigarette use, so good for you on that. I want to go through just a few more histories and we'll be done with this section, but it's important for me to understand your past psychiatric history. So have you ever gone to a psychiatrist or a mental health professional?
No.
Okay. Ever dealt with any mood problems like depression or anything like that?
I mean, I've never seen anybody for it, but I mean, I just think, you know, as time has gone on, managing this situation, I mean, I know you know, I'm just not happy with the way things are.
Right,
You know, I feel down a lot, and I don't have energy.
Right,
And it's frustrating. Am I depressed? Yeah, I probably am.
Yeah. But never spent any time in like a mental health hospital
No,
see
no,
things
no.
that don't exist
No,
or hear things,
no,
nothing
no,
like
no,
that.
no.
Okay. All right, good. And then in terms of your past medical history, I definitely have a good understanding of the chronic back pain. Any other medical problems that I should know?
No, I don't think so.
Okay. Any surgeries that you had that I should know about?
No, I haven't had any surgeries.
Okay. And then finally, in terms of past family history, have your parents ever dealt with any substance use issues or anything like that?
Well, my mother and her brother were very heavy drinkers. I guess you'd call them alcoholics.
Okay. Are they still alive?
No.
Okay, okay. Do you know what your mother or your father died from?
Heart attack.
Okay, all right. What about siblings? Any brothers or sisters that dealt with any mental health or substance use disorders or anything like that?
No, no. I'm an only child.
Okay, okay. All right, so at this point, we really have gone through a very comprehensive assessment, and I can appreciate, again, Mr. Campbell, that you are uncomfortable, so I want to move along.